Assalamu alaikum. This is Dr. Uzma Iqbal, and I'm here with your series, with An-Nisa's series of Let's Talk. I think we are waiting for a few minutes, and then we'll start. So, just want to say Assalamu alaikum. I think we are waiting for a few more minutes. I'm waiting for my my boss to tell me that we can go on. I'm actually still in my clinic. I'm talking to you from my clinic because we're still working, seeing patients. So I apologize ahead of time if you hear my phone ring or beeper ring. I've tried to kind of control that, but if it's an emergency, I apologize ahead of time. So we're going to wait a few minutes, maybe I guess another minute or so, and then we'll start. Inshallah. So, Assalamu alaikum once again. I'm Uzma Iqbal. I am a medical oncologist, and being a doctor in this time of emergency, I am considered an essential worker, and because of that, I have my clinic still open, and we are seeing patients in the clinic. We are seeing only patients that really need to come into the clinic, but most of the time we are doing telehealth, which is very different for us. It was not allowed for us to see everybody or talk to them on the phone or use video, but we are doing that with video conferences now. And of course we have to go see patients in the hospitals also, using all the protection and everything. So I want to give a shout out to An-Nisa for doing such a marvelous job, and in the name of Allah I'm going to start by having, I'm very appreciative of this time that that I'm able to spend with you. These are unprecedented times. No one has gone through a pandemic before. I for sure have not. About a month and a half ago, things were fine, or so we thought that they were fine, and now they're different. Everything has changed. Nobody gave us a heads up that how these things are going to change and what we needed to do. So in times of hardship, there's always lessons of growth and strength. And there's a reason why these lessons of growth and strength are there in the times of hardship. And it is because it may not be needed at this time, but it is definitely going to be needed for rebuilding or restoring. For example, restoring normal. whatever the normal may be. It may not be the normal that we thought before. It may be something very different. But it's these lessons that we learn and we use to equip ourselves and start seeing past this process. This too shall pass. Inshallah, we will come out of this, and inshallah we'll see happy times and healthy times. These are serious times. Of course, we need to be very careful. We need to be watching we need to be looking at the instructions, CDC guidelines. We need to make sure that even if we feel that we are not being of use by staying home and using all what is being asked of us, we are saving lives. So it's very important at this time. So it's these lessons of rebuilding that we see in this hardship that I want to talk to you about. So in my 20 years of being a cancer doctor and giving patients, cancer diagnosis and carrying them or walking with them through the cancer treatments, I've learned that it's extremely important for us to understand, where are the similarities. For example, a cancer diagnosis is a devastation for health, wealth, finances, spiritual. Similarly, this pandemic is a crisis of mind, body, spirit, intellect, faith. I mean, parts of us are not even able to grapple it intellectually, like what exactly is happening. So what are some of these tools that I want to talk to you about? I've learned them from my patients, from years of watching them go through the cancer diagnosis, the cancer treatment, and surviving and rebuilding themselves back to a better and evolved self. So we'll talk about powers. There are several powers we're going to talk about. For example, a power of intention. So in intention, niyat, we know in our faith tradition also how important it is to have an intention. So a daily check-in is extremely important. For example, a daily check-in on how are you feeling when you wake up? Are you feeling sad? Are you feeling joy? Are you feeling power? Are you feeling weakness? What are you feeling? Are you feeling connection to faith? Are you feeling disconnect there? So whatever you're feeling, you don't need to judge yourself. It's a non-judging acknowledgement of what you feel, and then just either write it down, record it. Even if it doesn't have to be long, just record it and do it daily. Do this exercise daily, because doing this exercise daily will allow you to do to get a library of your own feelings, and then you can revisit them back and again. And it's important because it's not only important for yourself, it's important for you to revisit back when you're starting to rebuild. In addition, it's extremely important to the power of permissions. Give yourself permissions. Give yourself permission to practice self-compassion. Many times we think self-compassion is selfish. No, it's not. Give yourself permission to be vulnerable, to feel anxious, to feel sad, to feel, fear. Give yourself that, permission. It's always good to give yourself a permission to set boundaries, especially in times like these when our norms are shifted and changed, and many of us are working from home. When we go out and when we work, or when we are in school, in college, at work, we have boundaries. Like, we know that we are away from the family, and maybe other people are, they're not going to call because I'm in clinic. But when you're all together, there is no boundary. It's extremely important to set boundaries. Set times while we are trying to kind of be with each other. Set times where we say we are not going to disturb each other. We have college-age kids at home. They're used to being in the dorm. They're used to being in their own apartments. They're used to their own schedule. Now they're home, so they're under our watchful eyes. Similarly, husbands and wives, everybody's just there. So I think it's extremely important to set boundaries, and also it's extremely important to say no. Learn to say no. If there's ever a great time to learn to say no, practice now. If you feel vulnerable, if you feel like you have failed, if you feel like you're failing to get that spirit up, it's okay to say, not right now, but I will get to it when I get to it. It's extremely and equally important to have power of imagination. It's extremely important to imagine. Imagine good times. It is very important to be present in this suffering, in this uncertainty, in this adversity. But equally more important to also imagine that you are imagining yourself when times will be better. What do you see? How do you see yourself? Imagine a healthier, happier you. Imagine a you who is more equipped for the changed times that are coming. For example, if it's a student who is right now, home and you are studying, but this is a great time. I mean, there may not be a lot of like face-to-face shadowing or face-to-face, summer jobs, but what can you do? Can you do online courses? Can you do some skills that you can learn by just for people who are around you? And then this will help you come out when things are better in a much, much, much better and more stronger and more powerful way. There is an important, very important power, and I think that's it's seen in spirituality and faith tradition, but it's also seen, it's very, very important. And the importance of that is finding abundance in scarcity. What does that mean? So right now, we are all feeling threatened, vulnerable. We don't know if our jobs are going to be there. We don't know what our businesses are going to be like. We don't know, if we are going to be part of the stimulus that the government is going to give or the small business loans that we may get from the government. We don't know. There's a lot that we don't know. But then in this time of not knowing so much and not having control over so much, what is it that we do know? How do we give in the time of scarcity? So find your abundance. I think it's extremely, extremely important to find the abundance. For example, find the abundance. If you are a young person, you have youth. You have power. You have intellect. You may have time. You may be blessed with resources like money. You may have a skill that somebody else can use. So yes, we don't know what it may be once we get better. But it is very important for us to know what we have right now. This power of finding abundance in scarcity is a practice that my cancer patients use all the time. I see them getting stronger and better and more evolved spiritually, more evolved physically sometimes, and psychosocially, because they use these powers to set up these boundaries, and they do set up this whole idea of how they are going to use this time, the time that they are going through diagnosis, which is like emotionally challenging, physically challenging, financially challenging, and they use all of that to come to break the mold that they were originally in. I have patients who have come out of abused relationship. I have patients who have left jobs that were suffocating or were not in line with their value system, and they have gone on to do better and stronger and and things, and then they have come out better, and they've used this cancer as a change agent. So these kind of there's a bit of a, we need to be careful about when we give these lessons in these times, because everybody's challenge is very different. But there's a power and a strength in utilizing your abundance in this time of scarcity. So I have a patient who I was asking. She has breast cancer, and she went through a lot of hardships, side effects. Like, she has been on chemotherapy for a year and continued to work because she is the only breadwinner for herself. I mean, there's nobody else that can offer her. So I was talking to her, and I was asking her, like, what is it that she she feels and she sees And she said she feels very blessed that God has chosen her to be a witness of his greatness. So yes, this is again an abundance. This is an abundance in the time of her turmoil and her adversity. So I want to take this opportunity to invite all of us, myself included, remind all of us, myself included, and motivate all of us, myself included, and say, yes, these are hard times. We are seeing people who are suffering. We are people who are suffering physically, financially, spiritually, but there are times like these which help us dig deeper into the strengths. So if you're feeling uncomfortable, lean into that feeling. Don't occupy yourself by noise, and don't run away from that feeling. Lean into it. You may find out something about yourself that is so much more powerful that it's going to stay with you forever. I'm going to give you a few practical tips also, because I want to be cognizant of the time. I think it's extremely important. Being a doctor, I can tell you, a lot of patients, a lot of people have no idea what diagnosis they have. They have no idea what medications they take. It's very hard for people to stay on top of this. So I do very much urge you, because nowadays what is happening, if you go to the hospital, they are not allowing other people to go in. They are allowing only the patients to go in. There's no visiting policy. So please make sure that you have a list of your, make sure you have a list of your medications. Make sure you have a list of your diagnosis. Make sure you have a list of your doctors. Make sure you have a list of your emergency contacts, your loved ones, and have that list copied in 2 or 3 different places. So if you are going to the hospital, and have it scanned into your phones or into a cloud-based system where if you need to access this, you can access this. I also want to encourage you to reach out and use your strengths by volunteering, and also very, very humbly, but encourage you to talk about your living wills, your medical power of attorney, and your advance directives, your healthcare directives, and make your will and make it available. Brother Joe Bradford did a I think Let's Talk episode in which he talked about the Islamic will versus non-Islamic will. Maybe I would request An-Nisa to prepare to give out some sites where we can prepare. You can actually handwrite something that you and your right without any pressure in your right mind are doing this, because if you don't have a will, then it becomes much, much more difficult. God forbid something happens. So make sure that your financial information is clear and transparent. Sometimes we have a little power struggle sometimes in our families, or maybe not because of that, for some other reason, where the wife doesn't know what the accounts are and who's the beneficiary, or the husband doesn't know if the wife is in charge of the finances. I think it's a great opportunity for all of us to address that. Write your beneficiaries, write your wills, make sure your bank statements and your financial things are in order, and also talk, just like we have a choice to live our life a certain way, we also have a choice to choose issues of end of life. So for our loved ones, talk to them about medical power of attorney. Medical power of attorney is not financial power of attorney. So it is somebody that a person like I may appoint, a person who understands me and my wishes, and will be, in case I cannot make those decisions, will be able to tell the doctors or tell the healthcare team what needs to be, what are my wishes or what needs to be done. We can definitely, if you're interested in this, do a separate topic, but this is where I want to talk. Inshallah, times will will be better. We will rebuild a better, stronger self, family, community, nation, and the world. So with that, keeping in time, respecting time, I will stop here. If there are any questions, I see there's a question about if I recommend that we get a will prepared, absolutely. Not only is it not only is it important for religious point of view from the current, if we don't have a will, then state takes over. So your children, and again you can go back and listen to the episode Joe Bradford did. The question of what is happening, there's a question about, are they cremating Muslims who pass away with corona? Again, if it's extremely important to have a list of family members, I don't want to set alarms, and I healthcare providers, and hospitals, they use the religious preferences. So Muslims are buried, but at the same time, please make sure that you have a will. So God forbid something happens, they can reach out to somebody. And whenever you are in any, have your will in copies. Don't have it in safe, because it's not, what is it doing in the safe? I mean, have a copy with your siblings or with your adult children, and have one in the house. So I'll end here. Jazakallah khair for allowing me to be part of this effort, and may Allah accept from all of us, from the An-Nisa team and everybody else who's working so hard and diligently in this rebuilding process. Assalamu alaikum.